Okay, so in this video, we're going to talk about those people who have back pain that continues to come on with bending forward. Now, if I haven't talked to you yet about pain and how pain works, the physiology of pain and the cognitive component of pain, then please make sure you talk to me about that before we get into, before you get into these exercises, because it is important to know how that works. So first and foremost, some people, as they go through their rehab, they continue to have problems with bending forward. And with that, sometimes there's a larger central component, but sometimes there is a peripheral component, meaning that the load from the muscles, from the fascia, from the tension that's put on nerves in the back will create a stimulus of pain as you go forward. A lot of that comes from the fact that I've got gravity pulling me in this direction, meaning all of those muscles and tissues are turned on in order to keep me from falling forward. So the easiest way that we can introduce load to those structures in a way that you have the most control is to take it from a against gravity situation and put it into a seated position. So here, if you think about it, the same position that I was there reaching to touch my toes is what I'm doing here as I bend forward to try to touch them here. So that brings us to our two exercises. They're both called sliders or gliders and then tensioners. And we use these in two different types of pain or two different levels of pain. So for somebody who has a lot of pain when they bend forward and they come out and it hurts for a long time afterwards, we call them irritable. Their pain is very easily irritated. And this is in opposition to somebody who has pain that comes on when they bend forward or do their activity, but as soon as they stop, it goes away. That's somebody who has very low irritability. It's not an irritated structure per se. Those people do better with the second technique I'll show, which is called tensioners. So let's start off with gliders. So if I want to create the same amount of pressure buildup in the back and the leg as I would with bending forward just without gravity, I would literally just sit here and bring my leg up. Now I can put a little bit more emphasis on this. I can do that first in the back by slouching more, and then in the foot by either pulling forward, pointing down, or pointing in and down, depending on how your symptoms present. So what we want to do first is just see where those symptoms just start to come on. So really move slowly into this progression because you really don't want to torque things up. So a little bit of slouch, bringing that leg up. If you feel only pain in the back and it doesn't change with the leg, this might not be the right exercise. If that's the case, let me know. We'll give you a different one. But in this case, you're just going to slouch, bring that leg up, and as soon as you feel some tension build up, you want to stop there. And then from there, add the ankle component a little bit. So just move it around. If that brings on more tension, then this is definitely a good exercise for you. Now that is just the way of testing your limits. You're not going to continue to do that with this exercise. So if I feel feel that stretch or that discomfort here, my exercise is going to be limited down lower than that, just up to the point where I'm touching that. Now, in order for this to be a glider, what that means is that as I put pressure on the system somewhere, so in this case, for the nerves, the muscles on the posterior chain, as I put pressure on them somewhere in the range of motion, I should have somewhere else in that field or that kinetic chain decrease this tension. So in this case, if I bring on the max tension in my foot back, my knee straight, I'll dampen that as I bring this up to glide the nerves and the structures by bringing on tension here, releasing it down there by pointing my foot. And then when I go the opposite way, I'm going to release my tension at the knee, but I'm going to bring it back on at the foot by pulling back. So my exercise would look like this. Now say that I am a little bit different. I bring on those symptoms with my foot pointed down and in with my knee straight. That means that for me to really release tension in one area and put slack in another, I've got to do it a little differently. So in this case, if this is my max tension, I'll release my tension at the ankle by bringing it to neutral. Now, as I release tension here, I'm going to add the tension back to the ankle by pointing it in and down. So in this one, I look more like this. And that is going to be gliding. Key concept with this one is that you want to get to the point where you're just shy of feeling anything, but you definitely don't want to feel any pain with this. If you do, too much, going too far into the range of motion. So that's one exercise. Now we have tensioners. In this case, the pain does go away pretty quickly. Here you want to bring on a nice stretch. You want to load the tissues up. Now, if you need that angle back at the ankle to really get the full sensation, you can set yourself up against the wall. That way the wall is pointing your ankles back. If you need to point down, you point down. But here you're going to bring on that tension by slouching, almost like you're trying to bring your belly button towards your toes, and then from there you should feel the pressure build up. 50% stretch, 50% discomfort is really the ideal dosage for this one. You'll hold that for about 30 seconds up to a full minute, ideally get to a minute, but when you're first starting, back off, go a little bit lighter. You'll do that 3 times and do that 3 times per day. If I didn't say that with the previous one, also do the previous one 30 repetitions 3 times per day. Now, with the tensioners, because it's a little bit more intense of a symptom that you'll feel, if you start to notice that your symptoms are getting aggravated with your daily activities, back off the intensity of the stretch. You're just going a little too far with it, so things are getting a little bit aggravated. So, the long-term goal is once you get very comfortable with that, then we reintroduce bending forward and coming forward to touch your toes. Which will put you back into the functional range of motion standpoint. It'll also decrease some of the sensitivity of the nervous system, which will allow you to do it in a less painful way. Now, if I've given you this video, you're all set. But if you are watching this video and you haven't talked to me, please speak to me or another healthcare practitioner to ensure that these are the appropriate exercises for you, because there are certain types of back pain that can get aggravated with these exercises. Without anything else to add to it, I hope you have a great day. Bye.